I am Dr. Nitin Rathi, working as a senior pulmonologist in Dharamshila Narayana Super Specialty Hospital, Vasundhara Enclave since last 1 year. Dear friends, today we discuss a ancient disease, tuberculosis. In India, tuberculosis is very prevalent disease. It is seen from ancient age when there is no treatment is available. Basically, it is an infectious disease. It is caused by a bacteria, Mycobacterium tuberculosis. It is basically categorized in two forms, pulmonary and extrapulmonary TB. When it involves lung, it is called pulmonary TB, and when it caused other than lungs, it is caused extrapulmonary TB. It is basically categorized into pulmonary and extrapulmonary TB because of infectiousness. If it involves lungs, it is infectious. When it does not involve lungs and involves other part of the body, it is non-infectious. Basically, it is called as a consumption disease. It basically decays the body as a whole. When patient came to us in OPD, he tells us if he is suffering from the pulmonary tuberculosis. Basically, main symptoms are cough, sputum, blood in mouth, fever, decreased appetite and loss of weight. And when patient is suffering from extrapulmonary TB, it symptoms according to symptoms involved. If the patient is suffering from bone TB, the symptoms may be related to localized site. If the patient is suffering from abdominal TB, then symptoms are according to local site. How we can diagnose the tuberculosis? For making diagnosis tuberculosis, microbiological diagnosis is mandatory. Why it is mandatory? Because there are two types of TB, normal TB and MDR TB. MDR TB which is not going to respond from the normal routine course of treatment. That's why the microbiological diagnosis is must. For this we have to take the sample from the site involved. In lungs we have to give a good quality of sputum for microbiological test. If we are not able to obtain good sample of sputum from lungs, we have to do bronchoscopy and we have to get bronchoalveolar lavage from the lungs. If this TB involves systemic disease, then we have to take